I'm Dr. Jason Bowlds. I'm a general surgeon, and every week I try to bring you videos discussing the treatment of diseases that affect the abdomen. Today's topic is on acute appendicitis. Acute appendicitis is the most common surgical emergency in the world. Your incidence of developing acute appendicitis is approximately 1 in 12. It usually occurs in the second decade of life between the age of 10 and 20 years old. It is rare before the age of 5 years old, but it is possible. Otherwise, it can occur at any time throughout your life, and it is not uncommon that we have to emergently take out an appendix from an 80 or 90-year-old. So what is the appendix? The appendix is a small tail that hangs off of the colon at the junction of where the small bowel enters the colon. Modern medicine, however, is at a loss trying to figure out the function of the appendix. It is likely a vestigial organ that is no longer used in digestion. Given that it is mostly made up of lymph tissue, it probably functioned in the immune system thousands of years ago. Next, we'll discuss what causes appendicitis. The lumen of the appendix is quite small, roughly the size of a pencil. In adults, the cause of appendicitis is usually a stone which forms over time, eventually obstructing the lumen. This causes the appendix not to be able to empty, and the secretions build up, causing the appendix to swell, and if not treated within a 48-hour window, this can rupture and spill infection into the abdomen. The symptoms of appendicitis usually include decreased appetite and worsening abdominal pain, which usually starts around the umbilicus or belly button, but may eventually wind up in the right lower quadrant. As the infection progresses, the patient may also develop fever and/or nausea and vomiting. Fleeting or short-term abdominal pain, which lasts less than a few hours, is likely nothing to worry about. Just know that any worsening severe abdominal pain that lasts longer than 6 hours should probably be worked up by a healthcare professional. The workup for acute appendicitis is usually straightforward. In the right age group and in the right setting, a physical exam concerning for appendicitis may be enough to warrant going to the operating room. But in this country, in most circumstances, a CT scan is the gold standard for diagnosis. A CT scan of the abdomen is between 90 and 95% accurate and sensitive for picking up acute appendicitis. If there is a concern for radiation exposure to the patient, especially in young children or pregnant women, then an ultrasound may be the preferred test to order. An ultrasound is approximately 80% accurate at picking up acute appendicitis. Once the diagnosis of acute appendicitis has been established, the standard treatment is surgical removal of the appendix or an appendectomy. Historically and throughout the world, this is usually done through an open operation. An open operation may require a larger incision over the appendix to remove it, and the healing time from such can be anywhere between 4 and 6 weeks. In the United States, over the past 2 decades, the treatment has shifted towards laparoscopic appendectomy. In a laparoscopic appendectomy, the patient is put to sleep and 3 small incisions are made to remove the appendix. A laparoscopic appendectomy compared to an open operation usually has a decreased chance of blood loss, decreased chance of infection, and a quicker time to work. After a laparoscopic appendectomy, most patients miss approximately 1 week of school or work. In certain cases where it is thought that the appendix is already perforated, especially cases where the patient has been sick for more than 3 or 4 days, or the CT scan shows an abscess already formed in the abdomen, then your surgeon may suggest delaying operation and treating you with a drain and antibiotics. In this circumstance, you may be in the hospital for 3 or 4 days, and you may have to come back in 4 to 6 weeks to have the appendix removed when it is safer. Lastly, we will discuss a topic which has been revisited over the past 10 years, that of treating appendicitis with antibiotics alone. Just know that these studies show that some patients can be treated with antibiotics, but the failure rate, both short-term and long-term, of those patients needing an appendectomy down the road is still somewhat high. And the gold standard, at least in adults, for acute appendicitis is still the surgical removal of the appendix. In children, the success rate of treating acute appendicitis with antibiotics alone may be somewhat higher, but this has to be a completely individualized approach and is dependent on your surgeon's comfort level doing so. The take-home of this video is that acute appendicitis is usually characterized by severe lower abdominal pain, usually on the right side, and usually that lasts greater than 6 hours. The standard workup usually includes a CT scan or ultrasound, and if it is thought that you have acute appendicitis, you should be referred to a general surgeon or pediatric surgeon immediately to avoid the risk of rupture and abscess. I hope this video has been somewhat informative on the topic of acute appendicitis. If you have found it helpful, then please hit the subscribe button below. As always, I am Dr. Jason Bowlds, trying to bring you better health through better education.